What if you could have an answer as to whether or not you were infected with COVID-19 within minutes at your doctor's office? A Richmond company has developed technology they say could revolutionize the way we test for and diagnose infectious disease.
Tonight, a Problem Solvers investigation. Our Laura French introduces us to this technology and tells us how soon it might be available.
COVID-19, the pandemic that seems so distant just 4 months ago, closed in on the Commonwealth with a quickness.
Virginia saw its first COVID positive case on March the 7th.
And with it came its challenges.
Everybody was struggling to bring up their laboratories.
We had very limited testing capacity.
Specifically when it came to identifying who had been infected.
Our turnaround time was sometimes 5, 7, 9 days.
Compared with other states, Virginia has struggled to expand testing. Data shows the Commonwealth has one of the lowest testing rates in the entire country. But while there are many opinions about who or what is to blame, there is work being done in the heart of Richmond's Biotech Research Park that could help us catch up.
If they were ready, would be at the front lines of COVID-19 testing.
Bob Juncosa and his team have been developing something they say could revolutionize the way we test for and diagnose the coronavirus and other infectious diseases, especially during a pandemic.
There is no doubt that technology like this could benefit every healthcare system in the world.
Juncosa is the Chief Technology Officer for Thermal Gradient, the company that has spent years developing these portable commercial prototype instruments that are designed to do rapid molecular testing.
There's always been a problem with DNA and RNA testing. That's to do a process called PCR, which is a very essential step. To do it fast and to do it simply. And that's what got me started in thinking about ways to do that.
PCR, or polymerase chain reaction, is the method many labs are using for COVID-19 and other diagnostics. It's used to make millions of copies of a DNA sample and amplifies it until it's large enough to detect. This is done through a multi-cycle heating and cooling process.
This is the key, is that the thermal gradient technology is all about doing this PCR step extremely fast. A typical test like this will take 1 to 3 hours, and we can do this test in under 20 minutes.
Bob, how do you do it so fast?
That's the secret sauce.
Saw the demo, talked to them about the science and the technology of it. I was extremely impressed. It was a rare combination of a very clever idea that's also very simple, and I think it has great potential to help people.
Dr. Weinstein compared thermal gradients technology to the time it takes to heat and cool a paperclip versus the time it takes with standard tests to heat and cool a cast iron pan. The Wake Med pathologist, who is on the company's advisory board but says he accepts no money from, tells CBS 6 that this technology could be a game changer.
It is possible that these instruments could be made simple enough for the user that they could, and relatively inexpensive, the instrument as well, not just the cartridge, that they could be in doctors' offices. It would have a huge impact.
And Juncosa says patients who get tested would know the results before ever leaving the doctor's office.
With systems like these, you can have access to that person in 15 minutes. You can hang on to them for 15 minutes, and now you can treat them or isolate them or go to the next step.
All the difference, he says, when trying to flatten the curve in the fight to stop the spread and safely reopen states.
One of the key issues in an outbreak like this is you don't want to hospitalize people you don't have to. And you don't want to not hospitalize people you do have to. So in the case of a molecular test or a PCR-based test, if it's done properly, you end up with better efficacy. You end up with better false positive and false negative, so that you're not missing people who are positive, not treating people who aren't.
Thermal Gradient, which has the backing of the National Institutes of Health and the Department of Homeland Security, says with the right financial partners and support, it could have the instrument ready for commercialization in as soon as 6 months. Meanwhile, the technology is not limited to infectious disease. It can test anything with DNA. For more on that, head to WTVR.com. Working for you in Richmond, Laura French, CBS 6 News.